August 2018 JCAT MDMS paper. MCQs number 740 is which of the following are associated with squamous cell carcinoma of the esophagus? Options are nitrosamine, hot beverages, chili chewing, chalia chewing, and smoking and alcohol. All of the above. These are all the risk factors for the esophageal carcinoma, squamous cell carcinoma, that is squamous. Risk factors are nitrosamine, hot beverages, chalia, smoking and alcohol. Which of the following are associated with increased risk of cervical carcinoma? HPV 18, 13, 16. So HPV 16 and 18 are the risk factors for cervical carcinoma. So the option is A, HPV 18. A patient presents with a long-standing history of constipation and on DRE examination he experiences severe pain. When you perform DRE, DRE is a digital rectal examination. Which of the following is the most likely diagnosis? Anal fissure, external internal hemorrhoids, anal carcinoma. The answer is the anal fissure causing pain on DRE. Which of the following converts fibrinogen to its active compound in the coagulation cascade? So the options are factor 2, factor 2A, factor 5 or factor 3. तो जो factor 2 है, factor 2 is the prothrombin. Factor 2A is thrombin and factor 2 converts fibrinogen to its active form, that is fibrin. Next is you are taking the blood pressure of a patient who has received multiple transfusion but you are not sure of which blood products. He has AML and receiving chemotherapy. You notice that while taking his blood pressure, his hand forms a tight claw. What is the reason? Hypercalcemia, anemia, hypocalcemia, hypokalemia. So claw hand will be found when there is deficiency of calcium. So in the case of hypocalcemia, patient with intermittent bleeding from his nostrils, maxillary heaviness, and on investigation creatinine is raised. What is your characteristic feature of your suspected diagnosis? What is the characteristic feature of your suspected diagnosis? क्या characteristic feature इसमें कौन सा होगा? Large vessel vasculitis, caseous granuloma, pulmonary hemorrhage, and then pauciimmune vasculitis. So the answer is pauciimmune vasculitis. Patient with vaginers will have granulomas that are typically necrotizing, and pauciimmune small to medium sized vessel vasculitis है. Next is a patient who had severe anterior uveitis presented in clinic. You note a milky white substance in the anterior chamber inferiorly that forms a meniscus. What is your diagnosis? तो सिनेरियो क्या है? सीवियर एंटीरियर यूवाइटिस के साथ प्रेजेंट कर रहे हैं एंड यू नोटिस अ मिल्की वाइट सब्सटेंस है इन द एंटीरियर चैम्बर inferiorly that forming a meniscus. So what is your diagnosis? And the options are hyperion, hyphema, hypopion, keratic respirator. So the answer is hypopion. Which of the following has a low glycemic index? Oats, chocolate, watermelon, water. So oats have a low glycemic index. A patient is receiving an oral anticoagulant after his aortic valve replacement surgery. Patient is receiving what? An oral anticoagulant. So he currently present to you after a road traffic accident RTA. You have stabilized his bleeding from a deep laceration with FFPs. What else you can give him? Oral anticoagulant receive करने के बाद patient currently present करता है with RTA. So what another thing what you will give to him? Tranexamic acid, platelets, vitamin K, naloxone. The vitamin K will be given. Thalassemia major patient has been receiving multiple transfusions. So now he has a hepatomegaly and cardiomegaly. You suspect an overload and want to start treatment. What will you give? IV defroxamine PO, defroxamine PO, IV defroxamine. So IV defroxamine will be given if multiple transfusion has given and patient present with cardiomegaly and hepatomegaly in thalassemia. Which of the following micronutrients has been associated with vitamin B12 deficiency causing a similar clinical picture? So that what is that vitamin causing the same picture as vitamin B12 which is causing the symptoms same like vitamin B12 deficiency? That is options are zinc, selenium, copper, manganese. So the answer is copper. If the deficiency of micronutrient of copper is there, it will have the same clinical picture as that of a vitamin B12 deficiency. Which of the following nerves innervates the vaccinator muscle? Facial, V1, V2, supratrochlear. Vaccinator muscle, facial provides motor innervation, V2 provides sensory innervation. So vaccinator muscle receives the motor supply from facial. V2 branch will provide for the sensory innervation. Which of the following would you try to do during a parotidectomy? Don't sacrifice the facial nerve, sacrifice the facial nerve. Leave uncared tumor margin. Leave behind parotid gland duct for drainage. So what will be the most suitable answer? Don't sacrifice for facial nerve. Which sinus develops first? Ethmoids, phoenoid, maxillary frontal. So maxillary sinus develops first. तो सबसे पहले maxillary sinus develops होता है. And then patient present करता है with burn and bruise on her left leg. So she had some injury to the spinal cord 3 months ago, which could be damaged. पेशेंट को ब्रूज है लेफ्ट लेग पे और इसको इंजरी हुई थी द स्पाइनल कॉर्ड 3 months ago. तो ट्रैक डैमेज वुड बी right lateral spinothalamic tract, right anterior spinothalamic tract, left lateral spinothalamic tract, left anterior. So the answer will be right lateral spinothalamic tract. A patient presents with dysphagia, dysphonia, and hemianesthesia of the face. Which of the following arteries are involved? Pica, ICA, sphere, cerebellar artery, mica, MCA. So the answer will be pica. Pica causes dysphagia, dysphonia, and hemianesthesia of the face. These are all caused by the pica, posterior inferior cerebellar artery syndrome. पेशेंट प्रेजेंट करता है चेस्ट पेन के साथ दैट इज रिलीव्ड बाय सिटिंग फॉरवर्ड. विच ऑफ द फॉलोइंग इज द लाइकली कॉज? पेरिकार्डाइटिस, पैंक्रियाटाइटिस, मायोकार्डाइटिस, Tietz syndrome. So the answer is pericarditis because vein of pericarditis is relieved by sitting forward. Pontine hemorrhage most common cause: diabetes, microvascular disease, uncontrolled hypertension, barrier aneurysm, CKD. So pontine hemorrhage is most likely caused by the uncontrolled hypertension. Which part of the spine is most commonly affected by the compression fractures? Which part of spine is common affected by the compression fracture? T10 to T11, L2, L3, L1 to L2 to L1. So option answer is the T12 to L1 is most common part of the spine that is affect होता है. तो that is T12 से L1. पेशेंट है A patient with periodic hypertension and sweating is started on alpha blockade preoperatively. What is the diagnosis? Neuroblastoma, adrenal adenoma, pheochromocytoma, medulloblastomoma. So the answer is pheochromocytoma, जिसमें alpha and beta blockers are given A before B. Alpha is given, alpha blockade first देते हैं and then beta blocker is given for the pheochromocytoma treatment. A woman in her labor suddenly says she is not having any more contractions and has severe abdominal pain, vaginal bleeding, and loss of the station of baby. What is likely diagnosis? Uterine inversion, uterine rupture, placental abruption, visa previa. It is uterine rupture, in which patient will present with a severe abdominal pain, PV bleed, and loss of the station of baby. It will be a case of uterine rupture. If there is uterine rupture, baby station will be lost. At what level of hemoglobin will transfusion not be indicated? 7, 8, 9, 10. 10. At level of 10, transfusion is not indicated. Patient who has hypothyroidism and has acute cholecystitis. Which of the following will you do? Euthyroid, then plan cholecystectomy. Proceed with laparoscopic cholecystectomy. Proceed with open cholecystectomy, plan interval cholecystectomy. So the answer is first make the patient euthyroid, then plan for cholecystectomy. Serum calcium level is raised. Which of the following ECG changes would you find if the serum calcium level is raised? Long QT, short PR segment, long PR segment, serum calcium level if raised. So the answer is B, short QT interval. If hypocalcemia, QT interval will be short. Which of the following drains beneath the middle turbinate? Posterior ethmoidal sinus, anterior maxillary sphenoid. तो इंटीरियर एथमोइडल साइनस सेल्स होते हैं ड्रेन करते हैं beneath the middle turbinate. Beneath the middle turbinate पूछा गया तो that is the anterior ethmoidal sinus cells. Which of the following is used as a graft vessel in cabbage? Internal memory, artery, internal memory vein, long saphenous vein, short saphenous vein. तो internal memory artery is used for cabbage graft. Which of the following branches of the internal memory artery artery यूज हुई थी? तो यहाँ पे भी आर्टरी का पूछा हुआ है. सप्लाई द पेरिकार्डियम एंड द thoracic diaphragm. musculophrenic perforating branches anterior intercostal pericardiophrenic. तो पेरिकार्डियोफ्रेनिक ब्रांचेस ऑफ द इंटरनल मेमोरी आर्टरी सप्लाई करते हैं पेरिकार्डियम को एंड thoracic diaphragm को. Median nerve is involved in which of the following pathogenesis? Median nerve is involved in which of the following pathogenesis? Cubital tunnel, guide tunnel, carpal tunnel. So it is involved in the carpal tunnel syndrome.